The real opportunity here is to sort of shift our mindset about healthcare, which is really much more sick care. You know, I'm trained in internal medicine, pediatrics, oncology. We have a system now where the data we get, whether it's our blood pressures or our genomics, comes to us in scattered, intermittent pieces. And so the data flows are broken, and we're therefore very reactive. We wait for the heart attack, the stroke, or cancer to present at late stage, or someone to need a kidney transplant. I'm most excited about this sort of super convergence, the ability now to move to much more continuous data, flowing through our smartphones and our connected rings and tied to our personal genetic databases, and then to be much more individually proactive as an individual. If you had your own sort of check engine light for your body based on your digital exhaust, your sort of Internet of medical things, and including to flow to your clinician, your healthcare teams, to pick up disease early rather than late, or if you have a disease like diabetes or anything else, to manage it in a much more smarter, tuned way. And we really live in this amazing exponential age. You know, 17 years ago when Dr. Collins was first sequencing the human genome, it was billions of dollars or millions of dollars. The price of sequencing has dropped at twice the rate of Moore's Law, to $1,000 or maybe $100 soon. The price of wearables and data are getting cheap. 3D printing is becoming something you can have in your home. So I'm most excited the fact that now clinicians, researchers, others from different fields can come together to look at how we can mash these up to address a lot of the challenges we have across healthcare.
Do you, I wanted to ask you a little bit also, all of you up here are, wear two hats. You know, there's the medical side, the research side, but also the entrepreneurial side. I'm curious, can you talk a little bit about the convergence between technology and health, Silicon Valley and medicine, and how has that evolved over the last decade? Yeah.
Well, you know, one example, I mean, we're here in 2017. It's only 10 years ago, essentially this fall, that the first iPhone launched, right? These have become, obviously, medicalized platforms. My old iPhone 2, this antique, would seem slow and clunky if you had to use it. It was magical at the time. The iPhone 10 that's coming out will soon seem antique. So what's been interesting, in at least where I come from out of the Bay Area, at Silicon, at Singularity University and Exponential Medicine, is that you've got a lot of folks coming from other technological fields, folks who do machine learning and have built games who want to apply them on our mobile platforms, or building, my antique Google Glass as well, VR programs, augmented reality, things that could be used for gaming are now being played out in the operating room. The challenge is often these folks are very enthusiastic, but a bit naive about to the realities of getting these things paid for, regulated, how a surgeon's going to interact with it versus a patient versus a caregiver, and sometimes those need to mash. But there's a lot of new energy, a lot of the new beginner's mind coming that's helping catalyze new thinking.
Can you talk about what are some of the pitfalls when you have this kind of this merging between these two kind of cultures or these two worlds? From what you've seen in recent years, like what's the potential and what's the pitfalls of some of that?
Well, some of the potential, we talked about all these omics information. The movie Gattaca, 20-year-old movie, raises some of the issues about what happens when you have your omics and others and people not understanding it or applying it in strange other ways. I started my medical residency at Mass General 20 years ago. I can't keep up to date with all the omics, let alone what was just published. So some of the pitfalls are not allowing it to come to the clinician at that last mile. If Dr. Tala's here looking at my genome, how's he going to pick the right drug or right 3D printed kidney for me? How do you integrate that? How do you take all the medical information and sift it and provide it proactively to the consumer, the patient, the caregiver, pharma, medical industry? So that's one of the pitfalls.